think the point is that it's inevitable that Kenya will have a big population. The Kenyan population will reach at least 100 million before the population stops growing. So the big question now is not about the numbers, because the numbers are more or less guaranteed. So now it's about how do we actually make sure that Kenya gets quality human capital out of its population. So we have to invest in people. We have to make sure that this population is going to be a quality population in terms of enhancing development for the country. So right now, 43% of the Kenyan population are under age 15. And as it is noted in Vision 2030, this is one of the major obstacles for development in Kenya. Because if you have that high child dependency burden, it's hard to invest in quality education, to address a lot of the issues that are actually affecting the education sector, quality of education, changing the education system so that you start focusing more on skill development, on innovation, on technology, and so on. Because there are more children coming to the system every year. So I think what we are saying here is that if the country can invest first in promoting family planning, in delaying in promoting education so that you delay marriages for girls and the onset of childbearing, but also we continue the investments in child survival, because parents want to be sure that their children will survive before they have fewer children. If you can enhance investments in these three areas, you invest access to family planning, and you enhance investments in care education, and you enhance investments in child survival, fertility will come down, and the country will now have a different age structure that has more workers than dependents. If those workers are going to be well educated, they are going to be skilled, and they are going to have jobs, Kenya's economy will just fly. That's what we are talking about. That's what the demographic dividend is. If Kenya invests in these 5 critical sectors simultaneously, we're not talking about just focusing on one issue like the economic infrastructure, which is where most of the focus is now. We are saying we should simultaneously prioritize investments in family planning, education, and child survival on the one hand to reduce fertility and have this favorable age structure. And then secondly, we invest in education, health, and job creation, as well as governance. If we can invest in what we are calling the combined model, the country will get an additional $2,500 per year per person, more than 2 times what it is now, just emanating from the demographic dividend. The demographic dividend actually manifests itself between 30 to 40 years. So it's a one-time opportunity that a country has, because after that, then the population starts shifting. You start having more older people than the working age population and the young people, because as fertility continues going down. So it's really something that happens over 30, 40 years. But you can't wait to start these investments in 20, 30 years' time, because it has to start now, so that you start building this quality labor force, you start reforming the economy to be creating more quality jobs, and you also, you start building the health infrastructure so that you have a healthy population. So the investments need to start now, and they need to be integrated. For example, Tunisia has actually managed to reduce its fertility. Women in Tunisia are having on the average 2 births. In Kenya now we're talking about 4.6 per woman, about 5. But because they didn't make these requisite investments in time, Tunisia hasn't benefited fully from the demographic dividend. And I think the discussions here are about preparing Kenya so that the country doesn't miss the bus as Tunisia. I think the point is that basically the country has one of the best set of policies in Africa as far as development is concerned. A lot of countries come to learn here on how to set up policies. The question is implementation. The question is in commitment to investing in all the ideas that the country has. So I think if you can focus on that, but also look at this Vision 2030. Is it really a governing principle at all levels of the country, or is it just the technocrats who understand this? I think for the country to move forward, we need to galvanize the whole country to be focused on that, so that when that teacher is teaching, they know that how is my work going to contribute to attainment of Vision 2030? That doctor who is sitting there, that laborer who is working there. So I think we need to inculcate that culture of getting everybody focused on where the country needs to go, and focus on you know, really operationalizing all the ideas that are in our development policies, including Vision 2030. So I think that's what the country needs to do, but the most critical thing is, let's not just pick up one sector and focus on that. Let's look at the broader picture. What does education, public health, family planning, child survival and so on, how do all these contribute to development? And when you integrate investments in these social sectors with the investments in the economy, then clearly the country is going to take a new direction in development.